1. Which of the following carious lesions is most appropriately treated with a preventive resin restoration PRR? A. Deep occlusal lesion into dentin. B. Incipient pit and fissure lesion. C. Class V lesion on the buccal surface. D. Large Class II lesion. 2. A 9-year-old presents with an avulsed maxillary central incisor. The tooth was kept in milk and reimplanted after 45 minutes. What is the most appropriate next step? A. Splint for 4 weeks and initiate root canal treatment. B. Observe and wait for signs of necrosis. C. Splint for 2 weeks and no endodontic treatment. D. Extract and consider space maintainer. 3. What is the most common cause of failure in Class II composite restorations? A. Polymerization shrinkage. B. Excess fluoride release. C. Pulp exposure. D. Thermal expansion. 4. Which of the following is a contraindication for implant placement? A. Controlled type 2 diabetes. B. Smoking less than 10 cigarettes a day. C. Bisphosphonate therapy. 4. D. Treated periodontitis. 5. A patient with a history of rheumatic fever requires a dental extraction. What is the appropriate prophylactic antibiotic? A. Amoxicillin 2G orally, 1 hour before. B. Metronidazole 500 mg orally, 1 hour before. C. Erythromycin 1G orally, after the procedure. D. No antibiotics needed. 6. Which of the following must be sterilized before use in a dental procedure? A. Surgical handpiece. B. Protective eyewear. C. Gloves. D. Disposable saliva ejector. 7. According to Australian standards, what is the minimum holding time and temperature for moist heat sterilization? A. 121 degrees Celsius for 30 minutes. B. 134 degrees Celsius for 3 minutes. C. 121 degrees Celsius for 15 minutes. D. 134 degrees Celsius for 18 minutes. 8. How should extracted teeth with amalgam fillings be disposed of? A. Incinerate. B. Autoclave and dispose as general waste. C. Place in Sharps container. D. Follow mercury waste disposal protocol. 9. Hand hygiene in dental practice should be performed A. Only before gloving. B. After removing gloves and before touching patient records. C. Only at the beginning of the day. D. After every 3rd patient. 10. What is the appropriate method of disinfecting impressions before sending them to the lab? A. Rinse with water only. B. Spray with alcohol and dry. C. Immerse in disinfectant for recommended time. D. Wipe with chlorhexidine. 11. The paralleling technique in intraoral radiography is preferred because it A. is quicker than the bisecting angle technique. B. Minimizes distortion and provides accurate measurements. C. Requires less radiation exposure. D. Does not require film holders. 12. The Alera principle in radiography refers to A. Maximum diagnostic output. B. Ensuring film is developed correctly. C. Limiting radiation exposure. D. Using digital X-rays only. 13. A radiopaque lesion at the apex of a non-vital tooth is most likely A. Periapical abscess. B. Cementoblastoma. C. Periapical granuloma. D. Condensing osteitis. 14. Which of the following imaging techniques is most appropriate for assessing temporomandibular joint TMJ function? A. Intraoral periapical radiograph. B. Panoramic radiograph. C. Cone beam computed tomography CBCT. D. Bite-wing radiograph. 15. When interpreting a panoramic radiograph, ghost images can result from A. Incorrect head positioning. B. Movement during exposure. C. Metallic objects in the field. D. All of the above. 16. Which of the following is the maximum recommended dose of lidocaine 2% with 1:100,000 epinephrine in adults? A. 200 mg, B. 300 mg, C. 500 mg, D. 700 mg. 17. Which analgesic is contraindicated in patients with peptic ulcer disease? A. Paracetamol. B. Ibuprofen. C. Codeine. D. Tramadol. 18. Which of the following antibiotics has the highest risk of causing pseudomembranous colitis? A. Amoxicillin. B. Clindamycin. C. Cephalexin. D. Metronidazole. 19. A patient is taking warfarin and requires a dental extraction. What should be done first? A. Stop warfarin for 3 days. B. Refer for INR testing. C. Proceed with surgery using hemostatic agents. D. Delay treatment until INR is below 2.0. 20. Which drug is most likely to cause gingival hyperplasia? A. Metronidazole. B. Phenytoin. C. Erythromycin. D. Lisinopril. 21. A patient requests their dental records. According to Australian law, you must A. Deny the request for confidentiality. B. Provide them within a reasonable time. C. Charge a penalty fee. D. Get approval from the dental board. 22. Informed consent requires that the patient A. Signs a form before treatment. B. Understands the risks, benefits, and alternatives. C. Agrees verbally in front of a witness. D. Pays in advance. 23. Which of the following is an example of a breach of confidentiality? A. Discussing patient cases anonymously at a seminar. B. Sharing patient details with another practitioner with consent. C. Talking about a patient in the staff room with others. D. Sending patient records securely for referral. 24. If a patient refuses necessary treatment, the dentist must A. Provide treatment regardless. B. Respect their autonomy. C. Report the patient to authorities. D. Dismiss the patient from the practice. 25. You suspect a colleague is practicing under the influence. You should A. Ignore it unless a patient complains. B. Confront the colleague aggressively. C. Report to the relevant health authority. D. Inform the patient immediately. Australian Dental Council. The Australian Dental Council ADC test is a comprehensive examination process that assesses the knowledge, clinical skills, and professional competence of internationally qualified dentists seeking to practice in Australia. The ADC test ensures candidates meet the standards required for safe, ethical, and effective dental care within the Australian healthcare system. The examination comprises 3 stages: the initial assessment of qualifications and documents, a computer-based written examination multiple-choice format, and a practical clinical examination that tests hands-on skills. This rigorous process helps protect public health and upholds the integrity of the dental profession in Australia, ensuring that successful candidates are well prepared to deliver high-quality care across diverse clinical settings. Here are the top 5 beneficial uses of the sample exam. 1. Pathway to dental registration. The ADC test is the official pathway for internationally qualified dentists to gain registration and practice legally in Australia, ensuring they meet national standards. 2. Validation of clinical competence. The test rigorously assesses clinical skills, critical thinking, and professional judgment, providing a recognized benchmark of safety and competence in dental practice. 3. Enhanced career opportunities. Passing the ADC test opens doors to employment in public and private dental sectors across Australia, increasing professional credibility and long-term career growth potential. 4. Public safety and confidence. The ADC process ensures only qualified, competent professionals enter the dental workforce, maintaining high public trust in Australian healthcare services. 5. Global professional mobility. The ADC qualification is well respected internationally, supporting dentists in pursuing opportunities in other countries with mutual recognition or similar standards.